Okay, this is the 8th session in acute AP critical care station in MRCS part B, and this is Dr. Ezi. So the next question by the examiner will be one of two. Either he will ask you about how to manage the pain of the patient of acute pancreatitis, or he is going to ask you about the how will you use the antibiotics in this patient. So we will start with the pain question, and how can you manage the pain. Okay, so any pain you want to manage in the examination, okay, you want to manage it according to the WHO ladder. Okay, WHO ladder. I'm going to manage her pain according to the WHO ladder. Okay, so two things you want to remember here, and these two things should not be given to the acute pancreatitis patient. Number one, you do not want to give a non-steroidal anti-inflammatory drug. Okay, and here you are not going to give morphine also. Okay, so morphine and non-steroidal anti-inflammatory drugs are not acceptable in acute pancreatitis. Other than that, you are going to follow the ladder. You are going to start from the paracetamol. Okay, and if it is not working, you are going to give some mild opioid like codeine. Okay, and after that, if this is not working, you are going to give a strong opioid like betadine, okay, or meperidine also, meperidine. These are allowed in acute pancreatitis. Okay, you can go to the patient-controlled analgesia. You can give something other than morphine there, because usually they use morphine in this. And you can go to the epidural analgesia. Okay, so these are the steps that you are going to follow and to say to the examiner. Follow the WHO ladder. Start from paracetamol, non-steroidals. Mild opioids, the next step, codeine. Strong opioids like betadine, you can use the PCA, but not with morphine. Okay, you can use betadine or meperidine, and finally you can use the epidural analgesia. This is the answer for this question. The other question about the antibiotics. Okay, and what antibiotics you are going to give? You are answer in two parts. Number one, no need for antibiotics if there is no evidence of infection. So if there is an evidence of infection, it is positive. In this case, you are going to use one of two. Number one, you can use carbapenem, and you can use quinolones, ciprofloxacin, and this quinolones. Okay, quinolones. These are the two options that you have when there is a positive evidence for an infection. Okay, I will see you in the next session, in which we are going to discuss the pseudocyst. Okay.